Hi there. What if I told you the most documentation problems begin before even taking a blood pressure? Most nurses think documentation starts when they open up the chart. I would argue that documentation starts with the first question you ask the patient. Because if you don't understand what's happening today, everything else in your note becomes harder. Today, we're talking about step one of the clinical thinking system. Current status. And this single step can completely change how you think through a home health visit. The problem. Many nurses walk into a home and immediately start gathering data. Vitals, medication lists, blood sugars, wound measurements, but they skip something really critical. They never establish the patient's current story. As a result, the note becomes a collection of disconnected facts instead of a clinical narrative. The clinical thinking shift that takes place is before gathering information, ask yourself, what is happening with the patient today? Not last week, not on admission, but today. Your goal is to create a snapshot of the patient's current condition. Think like a private investigator. Before you gather evidence, you need to understand the situation. Questions to ask. Try questions like this. How have you been feeling since my last visit? Or what concerns you most today? Has anything gotten better? Anything worse? Have you had any new symptoms? What has been the hardest part of your week? These questions reveal the story before you start collecting evidence. So, take for example a congestive heart failure patient. This is weak thinking. Patient seen for routine visit. Strong thinking is patient reports increased shortness of breath when walking to the bathroom and reports gaining 4 pounds during the last week. Notice the difference? One starts off with a task, but the other starts with a clinical situation. As your next visit comes around, spend the first 2 minutes trying to understand the patient's story before collecting data. And you'll be surprised how much easier the rest of the visit becomes. So in closing, in the next video, we'll cover assessment findings. Once you know the patient's story, you need evidence to support it. And that's where step 2 comes in. Well, I'll look forward to seeing you on the next video. Have a good day.